Welcome, everyone. I'm Joshua Stanwitz, the Coalition's Director for Arizona Concerned Veterans for America. Thank you for joining us for our town hall today with guest Congresswoman Lesko and Concerned Veterans for America Executive Director Nathan Anderson. Congresswoman Lesko represents Arizona's 8th Congressional District. In May 2018, she was sworn into the U.S. House of Representatives after winning a special election and was recently re-elected for a full 2-year term for the 116th Congress. Nathan Anderson is the Executive Director for Concerned Veterans for America and has been with CVA since 2013 and previously led CVA's nationwide grassroots initiatives. Nate is a warrant officer in Green Beret in the U.S. Army Special Forces. His deployments include Southwest Asia, the Middle East, and South America. Congresswoman and Nate, again, thank you for joining us today. And Nate, I'll hand it over to you.
Thank you, Josh. Thanks very much. Welcome, Congresswoman. Welcome everybody to this Concerned Veterans for America Policy Forum with special guest Congresswoman Debbie Lesko. I wish everybody well right now. I hope you and your families are safe and healthy. I'm Nate Anderson. I'm the Executive Director for Concerned Veterans for America. And for anybody unfamiliar with Concerned Veterans for America, our mission is to advocate. We advocate for policies that preserve the freedom and the prosperity that we and our families in the military fought and sacrificed to defend. And I truly believe that veterans, military families have a very unique relationship to freedoms and to the prosperity that we enjoy here in the United States. And that's because they have skin in the game. They've sacrificed. And because of that, I think that people listen. And what we've seen is people listen. Lawmakers listen, policymakers listen when we come together and when we elevate our voices. And so Concerned Veterans for America, CVA, we're building a movement of people that are willing to do that, to speak out, to be heard. And what we do is we amplify that message and we channel it so that it's effective. And ultimately, we want to show to the rest of the country that we can help other people rise in this country by standing together, by taking action together. And certainly, I think that if there was ever a time our country needed to stand together, I think it's now. The spread of the COVID-19 epidemic, it's creating lots of hardship, creating lots of anxiety in America in terms of people's health, in terms of income, people's livelihoods, even just physical separation from loved ones. It's really tough. And every part of our society is feeling it, from communities to our schools to our businesses, and that includes government also. And so we're here today to talk through some of these challenges, particularly through the lens of the military and veteran community. Some of the conversation is going to be focused toward those of you in Arizona, and some of it's going to be more broad, but I think it's all going to be applicable. All of it's going to be relevant because we're all Americans. So with that, Congressman, I just want to say welcome. Thank you so much for taking the time to be here with us. I understand that your responsibilities in Washington have kept you on your toes a bit.
They sure have. Thank you for having me. And I want to thank your members with Concerned Veterans of America and you and all the people that work for you. And, especially to the veterans out there, thanks for your service. And now we have active duty military, including we have our National Guard that are really stepping up and helping all over our nation during this crisis, as they always have done. So a big thank you. But yeah, I'm here in Washington, D.C. I flew in on the red eye. It was late Monday night, got here Tuesday morning. I was supposed to have a Rules Committee hearing on Tuesday night. That's why I flew in early. Well, that got canceled by Pelosi. And then we had it Wednesday night, and we were supposed to be voting on 3 things. First was the small business funding that we are going to be voting on and passing today. But that wasn't on the Rules Committee agenda. They decided not to put that in Rules Committee. But then we were supposed to talk about or vote on proxy voting for members, which I oppose, because I figure if we're going to have healthcare workers and grocery store workers go to work, I think members of Congress can go to work. And then the last one, which we weren't supposed to vote on, but then they put on in the last minute, was this Speaker Pelosi's Oversight Committee that will be another venue, in my opinion, for the Democrats to bash President Trump. And so here we are, and it's been a lot of action here in Washington, D.C.
Well, you're there. You're ready to work, it seems.
I have been working.
I believe it.
Mask and all. See, I have my mask, which I dutifully wore on the floor and took off when I spoke. And there's been a lot of shaming around here. Last night in Rules Committee, Jim Jordan didn't wear a mask while he was speaking, even though he was about 25 feet away from anybody. And of course, some of my colleagues on the other side of the aisle shamed him publicly for doing so. So it's interesting times.
Understatement. Very interesting times. Before we get into the questions, I just want to ask how your constituents are doing, including you, your family, your staff, during this rather difficult time.
Well, I'm doing good, thank God, and I give all credit to God, because I tell you what, last week I had a fever. And so I was like, oh no, I'm getting this thing. And so before I had a feeling that we were going to have to come out here to vote this week. And so I went and got a test. And by the way, in Arizona, for me, for anybody, it was pretty easy to get a test. I did not identify myself as a Congress member. All I did was call the main banner healthcare number, got a test within an hour, got the results the very next day, and I was negative, thank goodness. So I was able to fly to DC. But my staff is doing good. They're all healthy. They're working remotely, but they're working hard. The people in our district, it's a mixed bag. You know, there's some people that are fortunate to keep getting paid. They're telecommuting or teleworking from home. Others, of course, have to go in, like grocery store workers and healthcare workers. But there's a lot of people hurting. We're fielding hundreds of calls each and every week into our office, and my staff is there working full time. They're not in the office. They're telecommuting too, but they're answering constituents' calls. So we're there to help people each and every day, even now during the coronavirus.
That's wonderful. I know they do a lot of hard work.
They do.
My first question is actually on that. One of the things that I tell veterans or even active service members, their families, when they're having a problem with, say, the VA or maybe the DOD, whatever their situation is, one of the best resources for help is often the office of their senator or member of Congress. Can you tell the audience a little bit about what services your office provides to constituents having problems like that? Like the VA, and how they can get in touch with your staff?
Yeah, I have a full-time staff member, Jessica Rosa is her name. She's a veteran herself who works in my Surprise, Arizona office. And people can reach her by calling my office number, which is 623-776-7911. And again, her name is Jessica Rosa, and she works on casework for veterans exclusively. That's what she does exclusively. And so tons of veterans have called in with all kinds of issues before COVID-19 and now during COVID-19 seeking help, and she's been able to help them. I also have two groups that I meet with on a regular basis. One is my Military and Veterans Advisory Council that I meet with, and they're people from Arizona in different branches of the military and in different veterans organizations, and they brief me on what's happening in the veteran community. I also have a military and veteran community group, outreach group, that I meet with on a regular basis too, because I really want to know what's going on, boots on the ground, and it's really helpful that Jessica is a veteran herself, and so she just already knows a lot of stuff. She can already relate to a lot of things. And I had, previous to Jessica, I had Chuck Byers was my caseworker, and Chuck was very involved. He has like I think he's been retired like 2 or 3 times now. And because he keeps going back to work to help veterans. So he knows everybody throughout the state, and he's still on one of my councils.
Wonderful. That sounds like quite a team.
It's a great team. I've been very blessed.
That's terrific. I've done some work in the veteran advocacy space, and I always tell veterans that their first best advocate is themselves. But when they run into trouble, the member of Congress in their district is a great resource for some backup.
I agree. Also, for anybody watching, I also have a great website. It's Lesko, Lesko.house.gov. And especially on coronavirus resources, we have just about everything. So if a veteran owns a small business and is trying to get one of those small business loans, it says what banks are available. If a veteran out there or anybody, quite frankly, needs testing, like they have symptoms, it shows how they can go about doing that. I mean, it's a wealth of information. If they have elderly or people that need food, there's resources on there, including churches. There's quite a number of churches that are doing a lot of outreach right now in the community. I have a long list of people they can reach out to, including our office.
Wonderful. My next question is about what you do in Congress. You're one of 4 Republican members on the House of Representatives that serves on the Rules Committee, and this is a pretty significant responsibility. First, how did you come to serve on the committee?
Well, Kevin McCarthy, who's the top Republican, he's the minority leader, asked me to serve on it. And so you're right, I'm one of 4 Republicans. There's 9 Democrats on the committee, so we're kind of outnumbered. It's called the Leadership Committee. And what it is in Rules Committee, any bill that passes out of any other committee in the House of Representatives first comes to the Rules Committee before it goes to the floor for a vote by all of us. And so it's a good committee to be on because I learn all the bills, because I have the testimony from the chairman of the committee, the Democrat, who is usually for the bill. And then we have testimony from the ranking member, the top Republican on the committee, who is often opposed to the bill, not always. And so they say what the pros are, what the cons are. And then this is a place where you can put amendments on the bill too. And Rules Committee is very powerful because you can basically gut the entire bill and change it if you want to, if you have, of course, if you're in the majority and you have the votes. But even me being in the minority, I have preference to offering amendments because I'm a member of the Rules Committee. So even Democrat Chairman McGovern will usually allow me to offer at least one amendment on a bill. And so that's what's really beneficial for people is I've been able to put forward amendments, and some of them have passed. That I think are crucial to the bill. So it's a powerful committee. I wish we were in the majority; it would be more powerful then. But I'll take it. But sometimes it's very late hours. That's the downside of that committee is it can meet till 1 in the morning, later in the morning. It's a lot of work, but it's worth it.
Indeed, despite the fact that you're in the minority. On that committee, it still sounds like that's a tremendous amount of influence on your part and your colleagues when it comes to truly affecting policies that are going to impact the lives of a lot of Americans, including veterans and their families.
Yeah, it's a good committee to be on. And it's usually, you have Tom Cole from Oklahoma as the top Republican, Rob Woodall from Georgia, who's very witty, by the way, and I'm sorry that he's not running again for office. Dr. Michael Burgess is on the committee, and then me. So, it's a good committee, a lot of influential people on the committee, so I'm honored to be part of it.
I'm sure. Well, transitioning a little bit into legislation that impacts veterans, you were a supporter of the 2018 VA Mission Act that was passed just a couple of years ago. And a lot of veterans might be familiar with the Mission Act's community care program. That's the ability to choose a private referral if they're eligible for it.
Right.
But recently, the VA signaled a strategic pause of sorts on private referrals, and there's been some confusion around that, no doubt. Are you concerned about how this might affect veterans across the district and the country and their ability to access healthcare options that they need right now?
Well, yes, it's definitely a concern. Our office has found out is that if a veteran already has existing approval to go and get community care from outside providers, that has been extended, so they don't have to, worry about that. But if it's new, if they're newly asking to go to an outside provider, you're right, that has been paused. Now, I have to say a lot of the private providers are just doing telemedicine now too. And so, yes, it's a matter of concern, and we need to continue to work through it. But again, I want to reiterate that veterans that already have approval, is our understanding, that has been extended so that they can have it for longer and go see their private provider. But I'm a big believer in veterans should be able to choose whatever they want. So if they want to go to the VA center, because a lot of veterans, quite frankly, are very happy with the VA services. In fact, I just had a call today from a woman, both her and her husband go to the VA in Phoenix, and they said that they've had great outcome during this coronavirus crisis. They both, I guess she gets physical therapy, and she said she's been doing it via video conferencing, I guess. And so she's been very happy. And she said the drive-through pharmacy pickup has been really good. So we've got people that love the VA and they want to use the VA, and other people not so much. They've had a bad experience. So I think they should be able to go to an outside provider.
Despite what the VA may or may not be doing right now for some of those referrals, I don't think that there's any doubt that the delay in some of these appointments that the VA is doing, they're going to start to back up the longer this shutdown, if you will, continues across the country. Are you also concerned about the long-term buildup, if you will, of some of these appointments? I know that's a problem the VA has dealt with in the past, to include the Phoenix VA Medical Center there in Arizona.
Well, yeah, definitely. It's been a concern, and not just through the VA, but, nationwide. I mean, in Arizona, Governor Ducey just announced yesterday that he's going to open up elective surgeries again on May 1st. I think that's a good thing, because we heard from people that are in pain, or, they need things done. It's not like life-threatening, but they're in pain and they need things done, and they've been unable to get their surgeries. And so I think that's really good. I also heard from hospitals. I've been on conference calls with hospitals in Arizona, and, they were all prepping up for what they thought would be a huge surge of coronavirus patients, and they were worried about ventilators and everything. And so far, thank goodness, it's not been the surge that they had thought that might happen. And so a lot of the hospitals are hurting. They elective surgeries were halted, and that's how they make their money. They said that their emergency room volume was way down. And so I think part of the answer to all of this is what President Trump has put forward, is these different phases of reopening up the economy, because ultimately we can't afford in Congress just to keep giving taxpayer dollars to this. We eventually, in a healthy fashion, have to reopen our economy, have to open up the doctors again, the VA centers again. I mean, we just can't continue on this indefinitely.
We will. I have a question on that for you later. But before we get there, on the VA, one thing they've done traditionally pretty well is telehealth. And right now they're really leaning into that, encouraging vets to utilize telehealth. Can you tell us a little bit about what those benefits look like through the VA?
Yeah, and it was so my Jessica Rosa, who is a veteran and works in my office, she told me about Video Connect that the veterans have on their website. and how you basically, I mean, I didn't do it, but she said you basically go in and you request an appointment, and then they give you a meeting notice, and then you can do video teleconferencing with your physician, and then they can help. I've also been told that veterans with mental health issues, they're still doing counseling. I think maybe some is over video, but some in person, depending on the situation. And I believe I've also been told that on a case-by-case basis, going back to the VA Mission Act, where you can go see an outside provider, that on a case-by-case basis, the VA is also allowing people to go out into the private sector on that as well. But again, a lot of the private sector right now are doing telemedicine as well. Now, I went to a company in Arizona, it's over in the East Valley, it's not in my district, that really specializes in telemedicine. So this is actually very exciting. It's not just, over the phone, talking to a doctor over the phone. They actually have medical equipment, and one of their clients is the Department of Defense. And they actually have all this equipment that you can take with you and, do things. And the doctor on the other side knows all kinds of medical diagnostics. So I think that's the future, especially in rural areas. I mean, Arizona was in the forefront on telemedicine. It was actually Senator Bob Burns really was pushing for it because of the Navajo Nation, the Indian tribes in Arizona, and the rural areas. They didn't have enough doctors. And so the telemedicine was the answer.
At times like this, and even after this, there's always barriers to people accessing healthcare. This is just a great example, I think, of something that the government sector, but also the medical sector across the country can adopt more in the future and create less barriers for people to access these. Wait times, drive times for many people, like you mentioned, in rural areas, that could be a big barrier.
Yeah, no, I think it's a way of the future. Now, everything can't be replaced with telemedicine, but certainly some things can be replaced, especially when technology gets better and the equipment, like this company that I was talking to you about. I mean, they really have quite advanced equipment that's portable, that you can, use like out in the middle of, a state park or a federal park, or out in the middle of nowhere could be used. Also in rural areas, they have a bigger setup where you can do telemedicine and you can actually diagnose the patient. Not a doctor, but let's say a nurse might use this equipment, and then you have, through telemedicine, talk to a doctor and they can analyze the results. Banner Healthcare, it was years ago when I was in the state legislature, I toured Banner Hospital. They kind of have telehealth. They had for the ICU units in some of their hospitals, they had a location in Mesa. So in the middle of the night, let's say when there's not enough specialist doctors around and they needed some kind of specialist doctor, the nurse would go in and you could, via cameras, see what the situation was of the patient, and there'd be a doctor on call, in the middle of the night, so that nurses didn't have to wait around for a doctor to be called in the middle of the night. And sometimes they were hesitant to call in a doctor because they might get chewed out, in the middle of the night. So there's a lot of good things that can come from this.
Indeed. Unfortunately, we live in the future, and it's possible to do that.
Of course it is. Yeah.
The Phoenix VA I want to talk about. So 6 years ago, the waitlist scandal broke in Phoenix there, and that instigated a series of some pretty major accountability reforms at the Department of Veterans Affairs. And according to the VA's own hospital compare data online, the Phoenix Medical Center is 34th out of 38 when compared to other medical facilities in overall ratings. What are you doing and other advocates doing to ensure that veterans in that surrounding Phoenix area have access to the best care available and access in a timely manner?
Well, the first thing that I did is I met with the Phoenix VA Medical Center and went there in person, got a tour, talked to all the top people, although now they replaced the woman that so many of the veterans said was doing a good job and they were happy with her. So now, she's gone. So I have to go back again. One of the things I did legislatively is I have introduced a bipartisan bill that is called the VA Center Transparency Act, and it would require all of VA medical centers the directors to list what the problems are and how they're going to improve it, and then have that available to the public at each medical center. I co-sponsored that, or I asked my Democratic colleague from Las Vegas to co-sponsor that, Susie Lee, and because we had not a very good rating for the Phoenix Medical Center, a 1-star rating, and Las Vegas had a 2-star rating at the time. We thought it was a good idea. Now, hopefully when we get out of this coronavirus crisis and get back to regular order here in Congress, I can get that through the Veterans Affairs Committee.
Wonderful. That's a big problem, and glad to hear that you're working proactively.
Yeah, it's a big problem. It has been a problem for a while. And so that's another reason that I have these local boots on the ground groups that I consult with on a regular basis, my advisory council and my community outreach group as well, because they're the ones that are hearing from the veterans and their different groups that they belong with. And I want to hear from them. And I don't know how to fix it unless I know all the problems.
Indeed. Lastly, on the VA, one thing that we've seen a lot in the news recently, in fact, more and more from week to week, is that under the law, the VA has what's called a fourth mission. That's what people have been calling it. And this fourth mission is to serve as a contingency or backup during national emergencies, such as the one that we're currently facing. Can you tell us a little bit about how this works and if it's going to affect vets and VA facilities across the country?
Well, my understanding is they are a backup. They're a backup in case they're needed. It has been used in other states where they maybe need to treat non-veterans in the VA medical center. So far, I've been told it has not been utilized in Phoenix. They're getting prepared in case they need it. Let's hope we don't need it. But certainly whenever you take, there's already a backlog for veterans to see the VA medical center in some cases. And so when you start treating non-VA or veterans, then the concern is the backlog is even going to be higher. But I'm glad that they're there. I'm glad that they're there as a backup. It has been utilized in other states, but not so far in Arizona from what I've been told.
Indeed. And I know the VA Secretary Wilkie, he's continued to say that the first priority for the VA is taking care of veterans, which is comforting to hear from VA leadership.
I agree.
Now, to the spending question that we were going to cover earlier. As the federal government responds to this pandemic, there have been several very large spending bills passed in Congress. Military leaders have called our debt the greatest national security threat that America faces. Mm-hmm. And certainly these are unprecedented times. But how can we as a country change some of these federal spending habits so that when situations like this do show themselves, we're better prepared financially, fiscally to handle them?
Well, that's the $1 million question. And I totally agree with you. I've signed on to legislation that basically says, yes, our debt, deficit, interest payments are a national security threat. And I believe they are. And so every time we vote as members of Congress, we have to keep that in mind. Now, obviously, it's been too easy to spend money in non-COVID times. I'm talking about non-coronavirus times when we keep spending money, and because everybody likes getting more money, right? And it's kind of an easier thing to do, saying, oh, I'm helping these people, I'm helping these people. And so both Republicans and Democrats, I think, have been guilty of that. So we have to be more mindful, and it's difficult. I voted against some bills before that I get grief about it, saying, oh my gosh, you didn't spend money on this or that. Well, where is the end? Now, during the coronavirus, though, I have supported the first bill. I voted no on the second bill because we had literally 15 minutes to read the bill, and small business group, the NFIB, was opposed to the second bill. And then the third bill, the CARES Act, I supported, and now I'll be supporting more money for the small businesses. And the reason I support that is, of course, we're in a crisis, but also it was the government. It was the government that shut down all these businesses, and justifiably so. We're in the middle of this virus, but they're the ones that shut it down. So I figured it's the government that needs to help them now, because it was basically the government's fault that shut them down. But you're right. I mean, everybody's talking about another phase of the coronavirus, relief fund, and we should do this and do that. I think we need to put a pause button on this now. I mean, we've spent trillions of dollars. We need to see how the money is being spent, if it's being spent well or not. To give you an example, there was a 2-week holdup in getting this money out to the small business loan program that helps pay the employees of small business. But the Democrats wanted to add another $150 billion of funding for the states and local governments. Well, we already gave them $150 billion in the last package, the CARES Act, and none of that money has been distributed yet. So how in the world do we know that they need another $150 billion? There was also a concern, and I think justifiably so, that if we bail out the states, they're not going to really want to try to come up with a plan to reopen their economy because, hey, the feds are giving them a bunch of money, right? So, sometimes voting against spending bills is difficult. Constituents don't understand all the ins and outs. They're like, oh, why did you not spend on that? But it's like members, like your members, that give us the backup and say, no, that's the right thing to do. That's what I appreciate, because there are fiscally minded people out there, and they need to speak up and say, no, this was the right thing to do. We shouldn't be spending so much money.
I think you brought up an important distinction with this situation. It was the government that made the deliberate decision to shut down the economy, essentially. And so there's a sort of a responsibility that comes along with that to make sure that people have at least what they need for the time being because of the situation, as long as it's done responsibly, of course. And I think that's the devil's in the details there with how we're doing that.
Well, you're definitely right. Now, there is going to be a lot of oversight on this. On the CARES Act, which was $2.2 trillion, there is built in 3 different oversight functions in that bill. Plus, we have all these standing committees that have oversight. And now today, you'll see on the floor that Speaker Pelosi and the Democrats will vote for the 9th Oversight Committee. Republicans are, in most part, I think, going to vote no. I will vote no, and that's because we already have tons of oversight committees. Why spend another bunch of money on more staff? And they appropriated another $2 million for this other committee, which I think is just going to be another political committee that will attack President Trump and his response to the coronavirus. I mean, the chairman of the committee, nice gentleman, Mr. Clyburn, but he was the big fan of Biden and got him elected in South Carolina. So I kind of think that it's going to be more political than not. And that's unfortunate.
I know that you're watching. We're certainly watching also. America's watching. Congresswoman, this has been a very worthwhile conversation. Thank you so much. Before we wrap up, I just want to give you a chance to speak to the audience. What is your message? What's your message to constituents, to veterans, and to their families during this really difficult time?
Well, my message is hang in there. We're going to get through this. I know we are working together in Arizona. Thankfully, so far, it's not been as bad as predicted. And Governor Ducey is reopening up some of the things like elective surgeries, and I think he will do it on a step-by-step basis. Also, I'm a believer in God. God's in control, and he's going to get us through this. And so I say God bless you to everybody, and we're going to continue fighting here. I am in Washington, D.C., to help people through this crisis, but also to save our country. Quite frankly, I think my Democratic counterparts, some of them have some very radical ideas to change our country that I don't agree with, and I think it would ruin our country. And so I'm here. I'm fighting the good fight, and I hope to retake back the majority in the fall so that we can get some of more conservative legislation through.
Well, Congresswoman, thank you so much for your time. We really appreciate it, as well as your staff for the work that they put into making this happen and all the work that they do every day. They're working hard, both in DC and in your district also. So thank you for that. I also want to point out that we have a lot of hardworking Concerned Veterans for America staff that makes this possible. Thank you all for making this a thing. Lots of hard work into this. And finally, of course, our viewers, thank you for joining us, for spending your time with us. I hope this was valuable, and I hope that you're going to stay connected with us as our community navigates this particularly challenging situation. So be safe, be well. Thank you all. Josh, I will hand it back over to you.
Thank you, Nate. Congresswoman Lesko, thank you again. Nate, thank you for joining us here for the Arizona Town Hall. Thank all the viewers. And before we get off here, I just wanted to get some contact information out there again. So for anybody in Congresswoman Lesko's district, if you need help or information, please go to lesko.house.gov. For veterans in the district that may need help, feel free to reach out to her veteran constituent rep, Jessica Rosa. The phone number for the local office in Surprise is 623-776-7911. For those of us and for those of you that want to follow what Concerned Veterans for America are doing nationally as well as locally here in Arizona, you can follow us at Concerned Vets on Twitter, Facebook, Concerned Veterans for America, and then of course locally, AZ Concerned Veterans for America. And if any veterans out there need help or would like to get involved or more information, you're more than welcome to email me. My email is Stanwitz, STANWITZ at cv4a.org. And then we like to encourage all veterans and people to get involved in advocacy. So for those that want to do that, they can go to www.cv4a.org and click Take Action and can join us for more events and can be involved from the confines of their home safely. So everybody joining us, thank you again. Congresswoman and Nate, thank you, and keep up the good fight. Have a good day.
Bye. God bless.
Bye.